Okay, so what we're looking at here is an example of the bovine viscera that's been removed from the body cavity, from the abdominal cavity. We see the cranial aspect of the diaphragm with the liver kind of lying right up against that more caudal surface. The bovine liver is even less subdivided into lobes, so it's even a little more difficult to see these areas. But we see right here is going to be the area of the left liver lobe. And then usually right next to that is going to be the area of the right liver lobe. If we flip the liver over, that's where we can kind of see the more caudal aspect, or the deeper aspect. And it's in this area that we're going to see the area where the quadrate lobe would be. The quadrate lobe is always sitting right up against the gallbladder, and separating the gallbladder, separating the quadrate lobe from the right lobe. So we don't, unfortunately, have those nice deep fissures like we do in our small animals to tell. We just have to kind of look at the general vicinity of where these are. So left, quadrate, right. Here we see the caudate process of the caudate lobe, and we see the papillary process of the caudate lobe. Right underneath the liver is where we're going to see this very kind of significant or firm structure that kind of feels like a volleyball or a soccer ball. That's going to be the omasum. We also see the abomasum sitting just, or would be sitting just, ventral to that. We see our cranial part of our duodenum with the sigmoid loop present right here, turning into the cranial duodenal flexure, followed by the descending duodenum. We're going to flip over to the structures that would be found on the left side of the abdominal cavity. And as you remember, the left side of the abdominal cavity is pretty much taken up by the majority of everything is the rumen, with the reticulum being on the cranial aspect. So let's look at some of these structures, and we're going to start off with our esophagus. We see our esophagus would be coming through this esophageal hiatus. So the esophageal hiatus is present within the right crus of the diaphragm, so that very large muscular crus. The esophagus is moving down into the forestomach, or into the stomach. So if we look within the reticulum, we can tell this is reticulum because we have that honeycomb pattern with the reticular crests being kind of the walls you see here, and the open area between the walls being the reticular cells. Within the reticulum, if you open it up and look on its deep wall, that's where you're going to see this groove that's actually leading all the way up to the area of the esophagus. So this is the reticular groove, with the labia being essentially the walls of that groove. The reticular groove leads directly from the esophagus straight down into the omasum. It's within this area that we can see these very pronounced little papillae that almost kind of look like cat claws. If you open up the omasum, or the reticular omasal junction, you see some more of these little projections, these little papilla lining the omasal groove. These are what's called the unguiculiform papillae. Unguiculiform because they look like a nail, or like a cat's claw. Now, since we're already in the omasum, the only structure you have to be worried about here are these laminae, right? These sheets within the omasum. So let's come back to the reticulum. The reticulum communicates directly with the omasum as well as the rumen. So what we've done here is we've opened up the dorsal wall of the rumen. So we're actually looking down into the dorsal sac of the rumen. And if you look down into the dorsal sac, now we see some of the structures that are very significant. The way I've found it the easiest to orient yourself within the rumen is to use the cranial and caudal pillars. So here we see this little shelf of tissue. That's the cranial pillar. And then we see this X-shaped shelf of tissue, which is the caudal pillar. So the cranial pillar and caudal pillar are connected to each other by the right longitudinal pillar and the left longitudinal pillar. The cranial and caudal pillars, right longitudinal and left longitudinal pillars, are what delineates the dorsal sac from the area ventral to it, which is the ventral sac. So we'll go ahead and cover the ventral sac and then come back to the dorsal sac. We're now looking down into the area of the ventral sac. The cranial-most aspect of the ventral sac, where my hand is currently, is the ruminal recess, aka recessus ruminus. In the caudal region of the ventral sac, we will see this blind pouch, which is the caudoventral blind sac. The caudoventral blind sac is outlined by these two pillars here, which are the ventral coronary pillars, as well as the caudal pillar. Now, if we leave the ventral sac and come back into the dorsal sac, we see that there's another blind sac right here that's outlined by 1 and 2 dorsal coronary pillars, as well as the caudal pillar. So we have the caudodorsal, caudoventral blind sacs outlined by dorsal and ventral coronary pillars, as well as the caudal pillar. Now, the remainder of the dorsal sac again has been opened up, allowing visualization. So if we move cranially within the dorsal sac, then we get into this region right here that's between the cranial pillar and the ruminal-reticular fold. We can tell this is the ruminal-reticular fold because here we see all of these ruminal papillae, but if we look on the other side of this fold, we see those reticular crests and reticular cells. So this is the ruminal-reticular fold that outlines the ruminal-reticular ostium, or the opening between the reticulum and the rumen. So again, going back, this area that's delineated by the cranial pillar and the ruminal-reticular fold is something known as the cranial sac, or, since it's the entrance into the rumen, the atrium ruminus. All of these pillars that are seen internally, the only ones that I haven't talked about yet are the right accessory, and theoretically there's supposed to be a left accessory pillar, however we oftentimes don't really see that well. Going back to the right side, again we have the right longitudinal pillar, we have this kind of curvilinear right accessory pillar, and then finally this kind of half-moon shaped area within here is known as the insula ruminus. So all of these pillars correspond to grooves on the outside of the rumen. So right here is the area of the left longitudinal groove, which is where the superficial wall of the greater omentum would be attaching. And it's within this groove where we would find, if we were to open this up, our left ruminal artery. So our left ruminal artery is traveling within the left longitudinal groove. Back here we see our caudal groove, and then we have dorsal and ventral coronary grooves. So grooves are on the outside, pillars are on the inside. A few more things to note here. Since we're in this area, we're going to talk about some of the branches of the celiac artery. We can see a few of them very nicely because our celiac artery is actually right here. So some of the branches we can see from our celiac artery include the splenic which our spleen has actually been removed here apparently. But this one, we see this very large artery traveling down into our right longitudinal groove is our right ruminal artery. We see our reticular artery is traveling right along and next to the esophagus, down kind of in between the reticulum and the rumen. So that's the reticular artery. And finally, we have this very large artery coming off the reticular that's going on the medial aspect of the rumen deep and is going to come out over here. So again, that's our left ruminal artery that's going to be traveling in the left longitudinal groove. So those are all branches from our splenic artery. The next artery we're going to see is if we look right here, we see our omasum again, and we see this very large artery that's coming down to the omasum and splitting. The large branch that's coming over the omasum and coming right down here towards our lesser curvature is going to be our left gastric artery. And then we have this branch from the left gastric that's actually going under the omasum and popping out under here in between the reticulum, omasum, and abomasum. And that guy's traveling along the greater curvature of the stomach. So this artery is our left gastroepiploic artery. So that's a little bit different than we saw in equine. Our left gastric gives off our left gastroepiploic in the bovine, whereas in the equine, the left gastroepiploic, if you remember, comes from the splenic. The third branch off of the celiac is going to be the hepatic artery, which we see right here, coming over to the deep surface of the liver. It's at this area that we should be getting all of the branches of our hepatic, namely the large branch that should be coming. I don't see it here. I suspect it's probably broken. We'll try to find another cadaver that has it, but an artery that's coming over here right to the lesser curvature of the abomasum, which would be our right gastric artery. We also have this artery right here that's coming down and is actually going to flip under the duodenum and come to the greater curvature of the stomach. That's going to be our right gastroepiploic artery. And finally, we should have an artery that's traveling down between the descending duodenum and the pancreas, which would be our cranial pancreaticoduodenal. We'll have to find another specimen to see this on. So let's move on to our cranial mesenteric artery and see if we can't see some of the nice branching from it. So right here is where our cranial mesenteric should be coming off. Okay. Our cranial mesenteric, again, is going to be giving off, or should be giving off, a branch to our ascending duodenum, being the caudal pancreaticoduodenal. And then we also have the continuation of the cranial mesenteric right here, coming down along the mass of the jejunum. So in the bovine, these short little arteries that are coming off the cranial mesenteric, again, here's cranial mesenteric, these short little arteries going to the jejunum are the true jejunal arteries. So it looks quite a bit different than it does in the equine. A special or unique artery that's found in these guys is going to be this very large artery right here that's splitting off from the cranial mesenteric, but actually rejoining the cranial mesenteric distally down here. That's that collateral branch artery, to helping to supply extra blood to the cranial mesenteric as it comes down here to the jejunum. So here we see the termination of the jejunum as it turns into the ileum. So here we see the ileum coming and terminating into the cecum. So our ileum communicates and dumps into the cecum. And at that point, we see that the ingesta will then move from the cecum into this area known as the proximal loop of the ascending colon. The proximal loop of the ascending colon then will communicate with the spiral colon, which we see right here. So this still is the proximal loop of the ascending colon, and here we have the mass that is the spiral colon. The spiral loop of the ascending colon. The spiral loop of the ascending colon, the first or most proximal part that communicates with the proximal loop is going to be the centripetal or centripetal with a P for proximal. So the centripetal gyri. The centripetal gyri continue around until we get to this area right here where we see two very acute flexures. It's at this area that the centripetal gyri turn into the second flexure, which is the central flexure. So the central flexure is usually the second or more distal of these two flexures. At this point, we turn into the centrifugal gyri, F, centrifugal. And this is part of the distal portion or distalmost portion of the ascending colon. The centrifugal gyri continue outward. We see here, we'll continue outward right here until finally we get to this section right here, which is our distal loop of the ascending colon. So we go from centrifugal gyri to the distal loop of the ascending colon. The distal loop of the ascending colon then has this short little portion, which is the transverse colon, and then moves into the descending colon. So, just like an equine, the descending colon is supplied by the left colic artery, which would be within this mesentery here. We see an artery right here coming directly up to the transverse colon. That's what tells me that this is the transverse colon. So this is the middle colic artery coming to the transverse colon. Now, the distal loop of the ascending colon, as well as the centrifugal gyri, all these guys here, the centrifugal and distal loop of the ascending colon are all supplied by right colic arteries. So any artery you see going to the distalmost portion of the ascending colon are going to be right colic arteries. Now, the centripetal gyri, as well as the proximal loop of the ascending colon, are all supplied by colic branches of the ileocolic artery. So in the bovine, we see our ileocolic artery right here with all of these colic branches. And then if we follow this artery specifically right here, we see that this artery is actually the cecal artery. And in the bovine, the cecal artery should be giving off an artery over here to the anti-mesenteric side of the ileum, which is probably one of these guys here that is kind of stretched. That's going to be your anti-mesenteric ileal branch of the cecal artery. And finally, we have a mesenteric branch, or mesenteric ileal branch of our ileocolic artery, which again is traveling within this mesoileum. So, very nice view of the ileocolic artery coming off of that cranial mesenteric artery. So here we're looking within the pyloric area of the abomasum. So again, a ruminant viscera. Within the abomasum, we see these spiral folds, which are just essentially the rugae of the abomasum. And then we see this very large projection of smooth muscle that's actually projecting within the pyloric canal. And that's going to be the torus pyloricus. It's unique to ruminants and swine. And then as we move from the abomasum through the pyloric sphincter, we move into the cranial part of the duodenum. And it's at this area within the bovine that somewhere in here we should be able to find the major duodenal papilla. It looks like our bile duct has been removed here, but we'll try to find, here we go. Right there, that little opening you see right there would be your major duodenal papilla, which is where your bile duct in the bovine is going to empty, compared to down here, which here's our right lobe of our pancreas. Down here is where you're going to find your accessory bile duct, which would be opening onto the minor duodenal papilla within this region. So in bovine, they have a bile duct and they have an accessory pancreatic duct. They do not have the main bile or the main pancreatic duct that horses do.